Have you ever noticed how your grandmother or grandfather suddenly started having accidents, or how they seem to rush to the bathroom every 30 minutes, sometimes not even making it in time? Maybe you've seen the embarrassment in their eyes when they have to change clothes in the middle of the day, or perhaps you've heard them complain about that burning sensation that never seems to go away. What most people don't realize is that behind these situations, which many dismiss as just a normal part of aging, there's often a silent and preventable cause: urinary tract infections triggered by simple hygiene mistakes that nobody talks about. The truth is, over 60% of elderly people who suffer from recurrent urinary infections could avoid them just by changing a few daily habits that seem harmless, but are actually creating the perfect environment for bacteria to thrive. If someone you love is over 60 years old, or if you yourself are in this age group and have been dealing with these uncomfortable symptoms, what I'm about to share could completely transform your quality of life. These aren't complicated medical procedures or expensive treatments. These are simple mistakes happening every single day in bathrooms across the country. Mistakes that doctors rarely have time to explain in detail during a rushed 15-minute appointment. If you've ever felt frustrated watching a loved one suffer with recurring infections, or if you've personally experienced that cycle of antibiotics that seems to work for a week, and then the infection comes right back, you're in the right place. Before we continue, click the subscribe button and activate the bell notification. This way, you'll become part of our intimate health community, where we share real solutions that doctors rarely mention. Each video is like a detailed consultation, but in the comfort of your home. Subscribe now and begin your journey to a life without the discomfort of urinary tract infections. A recent study conducted by the American Geriatric Society found that nearly 40% of nursing home residents and 30% of elderly people living independently experience at least one urinary tract infection per year. But here's what's truly shocking. When researchers examined the hygiene practices of these individuals, they discovered that in over 70% of cases, simple changes in bathroom routines could have prevented the infection entirely. The problem is that as we age, our bodies become more vulnerable, our immune systems don't fight bacteria as effectively, and small mistakes that might not have caused problems when we were younger suddenly become serious health threats. What's even more concerning is that many elderly people feel too embarrassed to discuss these intimate details with their doctors or family members, so they suffer in silence, thinking it's just something they have to accept as part of getting older. But that's simply not true. Today, I'm going to reveal the 5 most common hygiene mistakes that elderly people make, mistakes that are silently inviting bacteria into the urinary system and causing those painful, recurring infections. Some of these might seem so obvious that you'll wonder why nobody ever mentioned them before, while others might completely surprise you. Let's start with mistake number 5. The 5th biggest hygiene mistake elderly people make is not cleaning properly after using the bathroom, and I'm specifically talking about the direction of wiping. Now, you might be thinking, doesn't everyone know you should wipe from front to back? Well, here's the reality that nobody wants to acknowledge. As we age, our mobility decreases, arthritis makes our hands less flexible, our vision might not be as sharp, and reaching certain areas becomes genuinely difficult. This isn't about not knowing the right way to do things, it's about physical limitations that make proper hygiene challenging. Let me tell you about Margaret, a 72-year-old woman from Ohio who came to our attention after her 6th urinary tract infection in 8 months. Margaret was a retired teacher, incredibly intelligent and well-informed about health, but she had severe arthritis in her shoulders and wrists. Every time she used the bathroom, the pain in her joints made it almost impossible for her to reach properly, and in her effort to just get the job done quickly to minimize discomfort, she was inadvertently spreading bacteria from the rectal area toward the urethra. She felt deeply ashamed about this and hadn't told anyone, not even her daughter who lived with her, because she thought it meant she was becoming incapable of taking care of herself. Here's what you need to understand about the anatomy involved. The female urethra, which is the tube that carries urine out of the body, is only about 4 centimeters long, compared to the male urethra, which is about 20 centimeters. This shorter distance means bacteria have a much easier path to travel from the outside world into the bladder. Escherichia coli, commonly known as E. coli, is the bacteria responsible for about 85% of urinary tract infections, and it naturally lives in the intestinal tract. When wiping goes in the wrong direction, even microscopically, these bacteria get transferred to the urethral opening, and from there it's a short journey into the bladder where they multiply and cause infection. 4. Elderly individuals. This risk is even higher because the immune system's ability to fight off these invading bacteria diminishes with age. A study published in the Journal of Gerontology found that elderly women who reported difficulty with personal hygiene due to physical limitations had 3 times the rate of urinary tract infections compared to those who maintained full mobility. So what's the solution? First, if you or your loved one is experiencing mobility issues that make proper wiping difficult, it's time to have an honest conversation about it. There are numerous assistive devices available that can help. Long-handled toilet tissue aids can extend reach for people with limited mobility. Bidet attachments, which can be installed on regular toilets for under $100, can completely eliminate the need for wiping and provide a much more thorough clean using water. Some people find that moistened wipes are easier to use than dry toilet paper, though it's important to choose ones that are specifically designed to be flushable and don't contain harsh chemicals that could cause irritation. Another option that's becoming increasingly popular is the use of peri bottles, which are small squeeze bottles filled with warm water that allow for gentle cleaning without the need for extensive reaching or wiping. The key is to remove the stigma and embarrassment from this conversation. There is no shame in needing help or using tools to maintain proper hygiene. The real shame would be suffering through repeated infections when simple solutions are available. This brings us to mistake number 4, and this one surprises a lot of people because it seems counterintuitive. The 4th biggest hygiene mistake is overcleaning or using harsh soaps and douches in the genital area. You might think that if infections are caused by bacteria, then surely more cleaning and stronger soaps would be better, right? Wrong. The genital and urinary areas have their own natural ecosystem of bacteria, what doctors call the microbiome, and this ecosystem actually serves as a protective barrier against harmful bacteria. When you disrupt this balance with harsh soaps, douches, or excessive washing, you're actually removing the good bacteria and making it easier for the bad bacteria to take over. Think about it like this. Your body has spent millions of years of evolution developing a defense system, and when we interfere with harsh chemicals, we're essentially disarming that defense. Let me introduce you to Robert, a 68-year-old man from Texas who is absolutely meticulous about cleanliness. After his wife passed away, Robert became somewhat obsessive about hygiene, worried that living alone meant he needed to be extra careful about staying clean. He was showering twice a day, using antibacterial soap on his entire body, including his genital area, and he couldn't understand why he kept getting urinary tract infections every few months. When his doctor finally asked detailed questions about his hygiene routine, the problem became clear. Robert's well-intentioned overcleaning was stripping away the natural oils and beneficial bacteria that protect the urethra from infection. His skin in the genital area had become dry, irritated, and more susceptible to tiny cuts and abrasions that served as entry points for harmful bacteria. A research team at the University of California, San Francisco, studied over 500 elderly adults and found that those who used antibacterial soaps in the genital area more than once daily had a 40% higher rate of urinary tract infections compared to those who used mild soap only once daily. The genital area, particularly in elderly individuals, has skin that's more delicate and sensitive than other parts of the body. The natural pH balance of this area is slightly acidic, which helps prevent harmful bacteria from growing. When you use harsh soaps, especially those with antibacterial properties, fragrances, or dyes, you raise the pH level and create an environment where bacteria like E. coli can thrive more easily. For women, this is particularly problematic because douching, which some elderly women were taught was necessary for proper hygiene decades ago, can push bacteria up into the vagina and closer to the urethral opening. The American College of Obstetricians and Gynecologists has been advising against douching for years, stating that it increases the risk of infections, but many elderly women never got that updated information and continue practices they learned when they were young. So what should you do instead? The best approach for genital hygiene is surprisingly simple. Use plain warm water for daily cleaning, and if you feel you need soap, choose a mild, unscented soap without antibacterial properties and use it only on the external areas, never internally. Once a day is enough for soap. For any additional cleaning throughout the day, warm water alone is sufficient. After cleaning, make sure to pat the area dry gently with a clean towel, because moisture creates an environment where bacteria multiply more easily. If you're someone who enjoys feeling extra fresh, consider using a simple warm water rinse in a bidet or peri bottle several times a day instead of soap. For women specifically, never use douches, vaginal sprays, or scented feminine hygiene products. These are not only unnecessary but actively harmful. Your body is designed to maintain its own healthy balance, and the best thing you can do is support that natural process rather than interfere with it. Now we're at the halfway point, and I want to pause here for something important. Let's pause for a moment. I want to ask you something personal, and I promise it's not invasive, but rather liberating. How many times have you felt that pain, that burning sensation, and preferred to keep it to yourself, without telling anyone, not even those close to you? It's as if no one really understands what you're going through, isn't it? This feeling of loneliness can be as painful as the symptoms themselves. If you identified with what I'm saying, I want to invite you to share your experience in the comments. It can be something simple like, "I've been suffering for years and never knew that overcleaning could cause infections." Your comment might seem small to you, but for someone reading it, feeling the same pain in silence, it could be exactly the light that person needs to seek help. You are not alone on this journey, and your story can help create a support network that many of us never had. Comment now, while this feeling is present, and let's together break this silence that only makes the pain worse. Let's continue to mistake number 3. The third biggest hygiene mistake elderly people make is not urinating immediately after certain activities, particularly after sexual activity and after bathing or swimming. When we're younger, our bodies can often handle small amounts of bacteria that enter the urinary tract, flushing them out naturally before they cause problems. But as we age, that natural defense system weakens, and bacteria that would have been eliminated automatically now have time to attach to the walls of the bladder and multiply. The simple act of urinating after activities that might introduce bacteria into the urethral area can be one of the most effective prevention strategies, yet it's something that many elderly people either don't know about or don't prioritize. Consider the case of Helen and George, a couple in their early 70s who had been married for 48 years. They maintained an active, intimate relationship, which is wonderful and healthy, but Helen kept developing urinary tract infections every few weeks. She was becoming frustrated and embarrassed, and it was starting to affect their relationship because she was beginning to associate intimacy with the pain that would follow a few days later. Her doctor had prescribed antibiotics multiple times, but the infections kept coming back. Finally, a urologist asked Helen a question that no other doctor had asked. "Do you urinate immediately after sex?" Helen looked confused and said no. She usually waited until the morning because she didn't want to interrupt the intimate moment or because she was tired and just wanted to sleep. That was the missing piece of the puzzle. During sexual activity, bacteria can easily be pushed toward the urethral opening, and if those bacteria aren't flushed out quickly, they travel into the bladder. For elderly women, whose urethral tissues are often thinner and more delicate due to decreased estrogen levels after menopause, this risk is even higher. A comprehensive study from the University of Michigan Medical School tracked 300 elderly women over a 2-year period and found that those who consistently urinated within 15 minutes after sexual activity had a 62% lower rate of urinary tract infections compared to those who waited longer or didn't make it a priority. The mechanism is beautifully simple. Urine flowing through the urethra physically washes bacteria out before they have a chance to climb up into the bladder. It's your body's natural defense system, but you have to activate it by actually urinating. The same principle applies after bathing, particularly after sitting in a bathtub or swimming in a pool or lake. Bath water, especially if bubble bath or oils have been added, can contain bacteria, and sitting in that water gives bacteria plenty of opportunity to enter the urethral opening. Swimming pools, despite the chlorine, can also harbor bacteria, and the combination of water pressure and movement can push bacteria toward the urethra. The solution here is to develop a consistent habit. Always urinate within 15 minutes after sexual activity. No exceptions. Make it as much a part of your routine as brushing your teeth. Some people find it helpful to drink a glass of water before intimate activity, so they're more likely to feel the need to urinate afterward. After bathing, especially after a long soak in the tub, make sure to urinate before getting dressed. After swimming, don't wait until you get home. Use the bathroom at the pool or beach as soon as you're done swimming. If you're caring for an elderly parent or relative, these are important topics to discuss sensitively but directly. Yes, it might feel awkward to talk about bathroom, habits, and sexual activity, but a moment of awkwardness is far better than watching someone you love suffer through recurring infections that could be easily prevented. We're now at mistake number 2. The second biggest hygiene mistake is improper use or prolonged wearing of incontinence products like adult diapers, pads, and protective underwear. I want to be very clear here. There is absolutely nothing wrong with using these products. They can be life-changing for people dealing with bladder control issues, allowing them to maintain dignity and continue participating in activities they enjoy. The problem isn't the products themselves, it's how they're being used. Many elderly individuals, either out of a desire to save money or embarrassment about changing frequently, or simple forgetfulness, wear these products for far longer than they should. The result is that they're essentially sitting in a warm, moist environment, contaminated with urine and sometimes feces, which is an ideal breeding ground for bacteria. Let me tell you about Dorothy, an 81-year-old woman from Florida who lived independently and was fiercely proud of her autonomy. Dorothy had mild incontinence and wore protective pads, but she was on a fixed income and was very conscious about expenses. She figured that if the pad wasn't completely soaked, there was no reason to change it, so she was often wearing the same pad for 6 to 8 hours or even longer. She started getting urinary tract infections so frequently that her doctor was becoming concerned about antibiotic resistance, meaning the bacteria were starting to become immune to the medications that normally killed them. When a visiting nurse finally observed Dorothy's pad changing routine during a home visit, the issue became obvious. The pads Dorothy was wearing had become saturated enough to keep the genital area constantly moist, and the bacteria from small amounts of fecal contamination were being held right against the urethral opening for hours at a time. Research from the Journal of the American Geriatric Society examined over 800 elderly adults using incontinence products and found a direct correlation between changing frequency and infection rates. Those who changed their products at least every 4 hours had infection rates similar to those who didn't use incontinence products at all. However, those who wore products for 6 hours or longer had triple the infection rate. The study also found that nighttime use was particularly problematic, with many people wearing a single product for 8 to 10 hours overnight. During sleep, people move less frequently, which means there's less air circulation, and the warm, moist environment persists for extended periods. So what's the proper approach? First, change incontinence products frequently, ideally every 3 to 4 hours during the day, and don't exceed 4 hours. At night, if you're going longer than 4 hours, consider using the most absorbent product available designed specifically for overnight use, and change immediately upon waking. If you're a caregiver, set reminders on your phone to check and change products regularly. Second, every time you change an incontinence product, clean the genital and perianal area thoroughly with warm water or specially designed cleansing wipes, and make absolutely sure the area is completely dry before putting on a fresh product. You can use a hairdryer on a cool setting to ensure complete dryness if necessary. Third, whenever possible, allow the area to be completely open to air for at least 15 to 30 minutes each day. Fourth, consider using barrier creams or ointments that contain zinc oxide or dimethicone, which create a protective layer on the skin and can help prevent both irritation and bacterial contact. And now we've arrived at mistake number 1, the most critical and yet most overlooked hygiene error that elderly people make. The number 1 biggest hygiene mistake: Elderly people make that silently triggers urinary tract infections is inadequate cleaning of the perineal area, which is the space between the genitals and the anus. Particularly for elderly men and women who have limited mobility or who can no longer shower or bathe independently as frequently as they once did. This is the area that your doctor might politely gloss over during appointments, that family members feel too uncomfortable to discuss, and that many elderly people themselves can no longer properly see or reach. But this small area of the body, often no more than a few inches of skin, can harbor enormous amounts of bacteria that migrate to the urethral opening and cause infections. Here's what you need to understand about why this area is so critical. The perineum is located in close proximity to three sources of bacteria: the urethral opening where urine exits, the vaginal opening in women which has its own bacterial ecosystem, and the anus which contains fecal bacteria. In a perfect world, these areas would be completely separate, but the reality is that they're all within a few centimeters of each other, and bacteria don't respect boundaries. When the perineal area isn't cleaned thoroughly and regularly, bacteria from the anal region can easily spread forward toward the urethra. For elderly individuals who may be dealing with minor fecal incontinence, even if it's just slight soiling that they're not fully aware of, or who may have difficulty cleaning properly after bowel movements due to mobility limitations, obesity, or cognitive decline, this area can become a reservoir of bacteria. Let me share with you the story of James, a 76-year-old man from Pennsylvania who was a retired construction worker. James had developed some mobility issues due to a bad knee and had gained weight over the years, making it difficult for him to reach around properly to clean himself after using the bathroom. He lived alone after his wife passed away, and he was too embarrassed to ask his adult children for help with something so personal. James started experiencing frequent urinary tract infections, which is less common in men than women, so his doctors were puzzled. After one particularly severe infection that required hospitalization, James finally admitted to his doctor that he was having trouble cleaning himself properly. A groundbreaking study from Johns Hopkins Hospital that followed over 1,000 elderly patients receiving home care found that 91% of those who developed urinary tract infections had inadequate perineal hygiene documented by care providers. The researchers found that when proper cleaning protocols were implemented, including thorough daily cleansing of the perineal area with appropriate techniques, the infection rate dropped by 73% within 6 months. So what is the proper solution to this critical issue? The ideal approach is to clean the entire perineal area at least once daily with a thorough washing using warm water and mild soap. This isn't something that can be done adequately while standing in the shower if mobility is limited. The most effective method is to either sit on a shower chair or at the edge of the bathtub, or to use a washcloth and basin while seated on the toilet or in bed. Use a soft washcloth or disposable cleansing cloths. Start from the front at the urethral opening and work backward toward the anus, using a gentle but firm motion. Never work in the reverse direction from back to front, as this brings anal bacteria toward the urethra. For women, make sure to clean between the labial folds, the area around the vaginal opening, and the entire perineal space. For men, clean the scrotal area, the perineum, and ensure the area under the foreskin is cleaned if applicable. After cleaning with soap and water, rinse thoroughly because soap residue can cause irritation, and then pat the area completely dry with a clean, soft towel. Now that we've covered all 5 mistakes, I want to give you the bigger picture. Urinary tract infections in elderly adults are not a minor inconvenience. They can lead to serious complications, including kidney infections, sepsis, which is a life-threatening blood infection, increased fall risk due to confusion and dizziness that often accompany infections in the elderly, and a significant decline in quality of life. The 5 mistakes we've discussed today are responsible for the vast majority of preventable urinary tract infections in elderly adults. Every single one of these mistakes can be corrected with knowledge, appropriate tools, and consistent implementation of proper techniques. You now have that knowledge. If you're an elderly individual struggling with these issues, please know that asking for help is not a sign of weakness or failure. Talk to your doctor, talk to your family members, talk to a home health agency. Make a commitment right now. Choose one of these. 5 mistakes that resonates most with your situation and commit to addressing it this week. Not next month, not when it gets worse, but this week. If it's mobility limitations affecting cleaning, research and order adaptive tools, or schedule an appointment with an occupational therapist. If it's using harsh soaps, throw them out today and buy a gentle, unscented soap. If it's not urinating after certain activities, set a reminder on your phone until it becomes a habit. If it's incontinence, product use, buy a timer or set phone alarms to prompt more frequent changes. If it's inadequate perineal hygiene, schedule that daily cleaning time and treat it as non-negotiable as taking medications. Small changes in daily habits can have enormous impacts on health outcomes. Remember, the goal here isn't perfection. The goal is progress and prevention. If this video helped you better understand what's happening with your body, imagine what the next ones can do for your health. Subscribe to the channel right now and join thousands of people who have already transformed their relationship with intimate health. Here you'll find more than just medical information. You'll find understanding, practical solutions, and a community that knows exactly what you're going through. Click subscribe, activate notifications, and together let's build a life with less pain and more well-being. Your health deserves this attention. Before you go, take a moment to leave a comment sharing your experience, or letting me know which of these 5 mistakes was most surprising to you. Your engagement helps this video reach more people who desperately need this information. Give it a thumbs up, share it with someone who could benefit, and let's work together to end the silence and stigma around these preventable health issues. Thank you for watching, and I'll see you in the next video.